Today's focus is on heart failure, a topic the NCLEX loves to test by asking you to differentiate between clinical presentations and prioritize nursing actions. The most common exam question will require you to distinguish between left-sided and right-sided heart failure. Left-sided heart failure is all about the lungs. When the left ventricle fails, blood backs up into the pulmonary circulation. This leads to classic signs of pulmonary congestion. The NCLEX will describe a patient with dyspnea, crackles on auscultation, orthopnea, and paroxysmal nocturnal dyspnea. A key indicator of severe acute left-sided failure is pink, frothy sputum, which signals pulmonary edema and is a medical emergency. The exam trap here is confusing these symptoms with a primary respiratory illness like pneumonia. The differentiating factor will be in the patient's history, such as pre-existing hypertension or a myocardial infarction, and the presence of an S3 heart sound. Now let's consider right-sided heart failure, which involves backup into the systemic circulation. This is often caused by long-standing left-sided failure. The exam will test your knowledge of its hallmark signs. Think of symptoms affecting the rest of the body. You will see jugular venous distension, or JVD, hepatomegaly, ascites, and dependent peripheral edema. A major exam point and a real-world nursing priority is monitoring fluid status. The NCLEX will try to trick you by asking for the best indicator of fluid retention. While intake and output are important, the most sensitive and reliable indicator is daily weight. A weight gain of more than 2 to 3 pounds in a day or 5 pounds in a week is a critical finding that needs to be reported. The exam also expects you to understand key diagnostic markers. The B-type natriuretic peptide, or BNP, is a crucial lab value. A BNP level greater than 100 picograms per milliliter is a clear indicator of heart failure exacerbation. Questions will present a patient with shortness of breath and ask which lab result confirms a cardiac origin over a pulmonary one. A high BNP is your answer. When it comes to interventions for a patient in acute distress, think about priorities. If a question describes a patient with severe dyspnea and audible crackles, your immediate priority action is not to administer oxygen first, but to sit the patient upright in a high Fowler's position. This maneuver uses gravity to reduce venous return to the heart and decrease pulmonary congestion, which immediately eases the work of breathing. Medication safety is another huge area. For diuretics like furosemide, you must monitor for hypokalemia. For ACE inhibitors ending in pril, watch for the persistent dry cough and life-threatening angioedema. For digoxin, you must know the signs of toxicity, which are often gastrointestinal disturbances like nausea and vomiting, as well as visual changes like seeing yellow-green halos. Before giving digoxin, always check the apical pulse for 1 full minute and hold the dose if the rate is below 60 beats per minute. To keep the two main types straight, use this simple mnemonic on your exam: left lungs, right rest. Symptoms of left-sided failure are found in the lungs. Symptoms of right-sided failure are found in the rest of the body. This will quickly help you analyze the patient data in a question and choose the correct pathway. Remembering this distinction and focusing on daily weights, BNP levels, and priority actions for acute decompensation will prepare you for the most common heart failure questions on the NCLEX.